In an emergency, a smile from a stranger comforts most of us to trust him with our lives and the lives of our loved ones. Behind that smile is a library of unforgettable tragedies that have been witnessed and thrown on a bookshelf of inadequate structure. I'm Dorann, Elam, a paramedic for the past 11 years and one of those strangers. I'm here today to persuade you in the belief that employers should provide mental health support for EMS providers. EMTs and paramedics are exposed to traumatic situations that increase their risk for mental health issues. The employers should be required to provide continuing psychiatric education and peer counseling to study that weakened structure. First, let's take a look at the problems EMS workers are faced with. EMT and paramedics' job-related health issues are on a continued soaring rise without any adequate support from their companies. Suicidal rates continue to climb for first responders. EMS World published in their article, Journal Watch EMS Death by Suicide, compared to the general public, EMS professionals had a 10-fold higher rate of suicidal thoughts and attempts. USnews.com article, Saving Lives Loses Themselves, says the nonprofit group Tema Conter Memorial Trust reported suicide among Canadian paramedics in 2017, a total 60% higher than suicides by members of the military. EAP, employee assisted programs, are optional with no minimal guidelines that companies have to follow. EMS is not only a public service, but they are healthcare providers that are well trained with unique careers. EAP counselors need to adapt to EMS and commonly not equipped to work with this unique group. Second, we need to visit the cause of this problem. Repeated exposure to horrific injuries and negative patient outcomes will wear away at any professional. The National Institute of Mental Health brochure and face sheet, post-traumatic stress disorder, PTSD, define PTSD as a disorder that people can develop from experiencing a shocking, scary, or dangerous event. Shocking experiences are seen over and over by first responders. Medical scenes turn scary when the patient stops talking to you, and now it is your duty to do your best to bring that patient back. Paramedics roll up in the middle of dangerous events blindly on many calls. In Little Rock, Arkansas, EMTs and paramedics are required to wear ballistic vests as a part of their uniform because of the safety concerns. Coping skills are developed over time to internally deal with the trauma scenes in which makes counseling first responders a major challenge for EVS therapists. Companies add general counseling to their benefit packages with no specialty training. Without knowledge in EMS, the services are ineffective. Employees won't go to a counselor that doesn't understand the hurdles that they've been stumbling over. Finally, let's move on to the solution. Lawmakers need to put requirements on companies that implement mandated mental health, continuing education, and peer counseling. Healthcare licenses of all disciplines are required to have continuing education for recertification, and these mandated mental health educations can be used towards those hours. The education can be tailored on the topics for whatever the majority wants to learn more about. The education can also help treat a growing population of patients that are commonly misdiagnosed in the field. Mental health population continues to increase over the United States, and a large portion are homeless and require EMS services. Peer counseling is an internal company program that gives employees someone confident to relate with, that has training and knowledge that can give them possibilities for treatment. Texas Health and Services, on their About Peer Support Services website, state by combining the experience with skills learned in formal training, peer specialists deliver services in behavioral health settings to support long-term recovery. By utilizing peers, they're around the coworkers and they can notice the warning signs before anything has to happen. This can decrease the incidence of suicide and get help to friends who may not say something themselves. As a paramedic, I've had several friends who have fallen into these holes that we've talked about without any responsibility to the companies that they've served. EMS workers are exposed to horrific scenes and an increased risk for mental health issues. I hope that it persuades you that the employer should be required to give the continuing mental health education and peer counseling that the paramedics and EMTs need. To work in EMS and think that you won't be affected is like running in the rain and not thinking you're not to get wet.